Bangalore. I am General Varghese, Residential Counselor here at the Medico-Pastoral Association, who will be the master of ceremonies for today's function. As most of you are aware, Medico-Pastoral Association registered in 1972 in the first non-government mental health organization in India and is credited with the pioneering work in the field of rehabilitation of persons with mental illness. Locally and nationally, MPA is well renowned for its contributions to the field of community mental health, particularly in the area of educating people about mental health issues. This year marks 51 years of distinguished service as achievement that the Medico-Pastoral Association wishes to celebrate with everyone. One of the many programs organized last year to celebrate MBA's Golden Jubilee year was a series of lectures each month and continued after that. We are delighted to have Dr. B.R. Madhukar, Medical Director and Consultant Psychiatrist at CADABAMS Group, who is a cricketer and qualified umpire from England, to deliver the 23rd lecture in the series on sports, fitness, and mental health. Today's lecture is aptly called Let's Play, Says the Umpire. This lecture will be followed by a brief questions and answers section to be moderated by the session chair, Dr. Ajit V. Vide. Now, I would like to request our residents of Medico-Pastoral Association to lead the group in prayer. Over to you.
Bind us together, Lord, bind us together with cords that cannot be broken. Bind us together, Lord, bind us together, Lord, bind us together with love. There is only one God, there is only one King. There is only one body, that is why I say, bind us together, Lord, bind us together with cords that cannot be broken. Bind us together, Lord, bind us together, Lord, bind us together with love. We are the family of God. We are the promise divine. We are God's chosen design. We are the glorious new one. Bind us together, Lord, bind us together with cords that cannot be broken. Bind us together, Lord, bind us together, Lord, bind us together with love.
You're mute, Daniel, you're mute.
Thank you, dear residents. Now I request that Mr. Bhaskar, who is the administrator of Medico-Pastoral Association, to welcome the gathering. Over to you, sir.
Thank you, Daniel. It gives me immense pleasure to welcome our audience for today's lecture, which is to be delivered by Dr. B.R. Madhukar. Before I do that, I would like to share that this welcoming responsibility during this 23rd Suvarna Lecture is a huge thing, because prior to this, other 22 lectures which have been completed, the welcoming were all done by the members whom I see as role models, professionally and personal, which means big boots to fill in, and hope I do justice to this task. Dear audience, I would like to mention that the previously completed lectures are uploaded on our YouTube channel, Medico-Pastoral Association, requesting all of you to watch and subscribe if you have not done so, to get more updates of MPA. Why I say that is, previously, members who have spoken about MPA, they have given you, that gives you a full picture of what we are and how we came about and the journey that we had so far. MPA from a staff standpoint of view is a wonderful combination of volunteers and staff, which is dynamic by nature and is like two faces of MPA coin.
Thanks.
This combination signifies the relentless partnership bearing in mind the welfare of persons with mental illness. Being a staff and my experience at MPA gave me opportunity to watch our volunteers closely who are giving their time and energy without any expectation, and that has developed in me an admiration towards them. As I mentioned before, today is the 23rd Suvarna Lecture, and this series began in the month of February 2022, and eminent personalities from various fields have spoken. The lecture series brings about holistic perspective coverage on matters related to mental health. Before I welcome our speaker for the day, just want to brief the audience about a special cricket tournament called Bengaluru Rehabilitation Cricket League, known as BRCL, a tennis ball tournament organized exclusively for people with mental health problems. Now, I take this opportunity to welcome our speaker for the day, the multifaceted psychiatrist, ardent cricket follower, and chairperson of our BRCL committee, Dr. B.R. Madhukar. I welcome the members of MPA, starting with President Dr. Joseph George, Vice President Dr. Ajit Bide sir, Secretary Mr. Alphonse Kurian, and all the other members who are there. A special welcome to Rohini ma'am. Despite her health issues, she's with us today. She happens to be a chairperson of Academic Public Service and Publications Committee. Mr. Samuel Mohan, our managing committee member, and all the other well-wishers of MPA. Last but certainly not the least, I would like to welcome our staff and residents of MPA. Thank you so much for giving me this opportunity. Over to you, Daniel.
Thank you, sir. Medico-Pastoral Association commenced in 1964 as the first and the oldest registered non-governmental organization to step into the then unexplored territory of rehabilitating mentally ill persons in India. It has for over the past 50 years continued to make strides in the realm. Apart from providing a surrogate home for individuals with the disabilities arising from psychiatric illness, it also caters to many other needs of the people with the difficulties. As early as 1964, much before any formal or conventional forms of intervention were introduced, a group of volunteers comprising professionals like doctors and clergymen under the Urban Industrial Mission program of St. Mark's Cathedral, Bangalore, got together to create awareness and to provide training in skills required to remove the fear and misconceptions surrounding mental health problems. The movement initiated by these volunteers has been effective in the promotion of mental health and care of mentally ill, and culminated in the formation of Medico-Pastoral Association. The vision of MPA is a holistic approach to mental health, improving the emotional and social well-being of individuals and society, focusing on the wellness of person and wellness of society and the challenges ahead. We endeavor towards recovery-oriented rehabilitation aiming at full integration of persons with severe and chronic mental disorders into the mainstream. Rehabilitation, re-socialization, resettlement will continue to be the motto. May I now welcome the Honorable Vice President of MPA, Dr. Ajit V. Bide, to introduce the guest speaker, chair the session, and also facilitate the discussion and question and answer after the lecture. Over to you, Doctor.
Thank you, Daniel. Well, much has been said about our guest speaker today. I'd just like to recall that a month ago, a little over a month ago, Madhu and I were at a doctor's meet organized by the Indian Psychiatric Society Karnataka chapter for a foundation day of the Indian Psychiatric Society at the national level. And we were chatting and I suddenly thought, why not have Madhu? It's about time we had Madhu as our Suvarna lecturer. So I told him that I requested him to be our next guest speaker. He said he'd take a little time about it. In about 3 minutes, he agreed that's Madhu for you. Never take very long to make a decision. And once you make a decision, abide by it. True sportsman spirit really in evidence. Then he turns around to me a little nervously and said, but what shall I speak on? So I said, any topic that pleases you. And knowing that he had brought a great element of sport and games into our lives in the field of psychiatric rehabilitation, I said, why not something to do with sport? He said, I'll think about it. And again, in 3 minutes, he decided that he'd speak on sports and how sports help with mental health. He has given a very catchy title for today's talk. It's Let's Play, Says the Umpire. Very, very apt and witty title there, Madhu. Madhu is a passionate cricketer, an umpire, and he mentions in the biodata sent to us that he's an accidental psychiatrist. For an accidental psychiatrist, I dare say he's a pretty good psychiatrist. He can't but spend a little more time on the growth of the various cricket leagues that he has founded, most importantly, BRCL. He's not just the chairman of the BRCL committee, he's the guy who introduced league cricket to so many fora, mainly involving doctors or mental health professionals. There is one for the rehabilitation centers where the residents of rehab centers take part. There is another for staff of rehab centers, but those are only two. There's another for the Psychiatric Society at the state level, at the zonal level, at the national level, all of which was started by Madhu. There was also another one for doctors in Bangalore. And he is also a great builder of team spirit. He introduced the first doctors quiz through the ages of the St. Martha's Hospital, where both of us worked for some time, and I'm still there. And it was called Sarvajna. So he is a guy who has done a lot in the extracurricular realm in general, and sports and games in particular. And it's a real pleasure to have you with us, Madhukar. You must also remember that Madhukar was our managing committee member for many years until he moved on to other realms. He did his medical training from the Government Medical College at Bellary, the DPM from NIMHANS soon after. He was also at the University of Leeds, where he completed his DPM, and the Royal College of Surgeons of Ireland. He is a qualified umpire from England, Lords, no less. So, my Lord, it's very nice to have you with us. He has played cricket till university level and senior level at Yorkshire. His passions are many, among them classical music. He has learned violin. He plays the violin both the Indian and Western classical style. And he can't stay away from politics, which is his other passion. I would also say that he's a very spirited man and always willing to help anybody who needs his help. Just mention it, and Madhu is likely to be there to help you out. Before I hand over to Madhu, I'd like to welcome some special guests. I see Madhu's family, Dr. Anita and Neha, are also joined us. It's lovely to have you with us, and I hope you'll join us for other MPA ventures as well. Dr. Abhay Matkar, President, Indian Psychiatric Society South Zone President, is with us. Great to have you here, Abhay. And I welcome to all the people outside MPA who've joined us, who I hope will make it a habit to join our lectures henceforth. But I'm really looking forward to what Madhu has to say. So over to you, Dr. Bangalore Rajan Madhukar.
Good evening to all of you. Let me take this cap off and show that it's the MPA emblem, the BRCL. Okay. And of course, this T-shirt also, which has the MPA emblem on that. So yes, first of all, I should not be introduced as a guest speaker because I'm part of MPA. I've been a member of MPA for close to 20 years, and I must thank Dr. Ajit Bide for introducing me to MPA. When he drove me from the St. Martha's Hospital to MPA, and that's how I became a member of MPA and have continued my association, a very fruitful association, in fact, which I always cherish. Now, at the outset, let me first and foremost congratulate MPA on celebrating 50 years of glorious service. And we all know in private practice, even surviving a month or a year, it's so tough in these days. And having served people with mental illness and continuing to serve with such a glorious past, really, really hats off to MPA. And on organizing the talk by very eminent people on this occasion. Every time I saw a list of, I saw the list of guest speakers, obviously I was in awe with their contribution in the field of mental health, and I admired their dedication and commitment. Never thought a day would come where I would be one of the speakers too. It's a great pleasure and a humbling experience to be here this evening amongst all of you. Yes, Dr. Ajit Bide already talked about our interaction and about the discussion about giving a talk. Having known him for 20 years, initially I said, wouldn't it be better for an academician to give a talk? But soon realized that he wouldn't take no for an answer. So I said, yes, I had no choice but to agree with that. But I happily agreed because naturally this is one of those areas which is very passionate and I feel happy to talk about it. I hope I do justice to the trust he and the rest of you all have in me. Where do I start? Thought I should do a presentation as a psychiatrist or as a sports person. I swear in the name of Almighty, I know nothing but cricket. So obviously, I have to shift towards being a sports person, which I'm more comfortable, but clearly, I'll try and balance what I can do. Can I have this slide, please? I will have the help of my colleague, Mr. Chetan. If you can give me the permission for me to upload the file,
Yeah,
please.
sure. Share screen. Share screen is where you need to go.
Share screen. Yeah, here it is. Oh, this one. Yes. Start from screen.
Slideshow. Slideshow. From current slide. Yeah. You're
Dr.
mute.
Madhukar, sir, you're mute, sir.
You have to unmute.
Yeah. Can you hear me now?
Yes, sir, we can.
So just imagine you're all watching a cricket match. All the fielders are ready. The batsmen are ready. And what does the umpire say? Let's play. That's a call given by the umpire to say the play begins. So I thought, let me have that as the title. But as we go along, I will try and talk about my experience too later. Can I go for the next one? No, it's not. Huh. So, as any sports person will tell you, there are a lot of sacrifices, a lot of things happen. So let me start with acknowledgement rather than having it at the end. I thought I should first say my thanks to my family, my not just my wife and daughter, but a lot of my the family members, including my brothers, my parents, who all actually left me to myself. Probably they realized that I won't listen to them. They probably would have no effect on me, so which is why they left me to myself. All my captains, players, and umpires. Now, we all know that cricket is a team game, so you have the people who will guide you. Third is about the managing committee of St. Martha's Hospital. I'll come back to that a little later, who gave a lot of confidence, played a big role in furthering my cricketing career as well as the organizing of cricket matches. MPA, the whole of MPA, residents, the president, honorary secretary, not only the president, all the office bearers from the time I have been a member of Medico-Pastoral Association. My teachers, Dr. Mohan Isaac, Dr. Ajit Bede, whom I've learned a lot I had my own doubts about so many things, not only my career, about the other things which they've always been very supportive and been a guiding spirit. This Rohini, who has been constantly in touch with me. And of course, I know she is not well today, but I hope she takes part in the discussions later on. My employers, now, you know very well that these days, the balancing of sports as well as the work is difficult. And working in the private space, you need the help of your employers. And without doubt, both CADABAMS as well as Manasa, big role actually for CADABAMS in encouraging me, allowing me time to go and continue with my passion. So, and Dr. Sunil Sharma, I must again admit, given the kind of the schedule I have, and not just last week, both of us were in Kochi for a conference. Again, I was involved in cricket, and today and next week, again, one more cricket tournament. Very difficult. So I had to share with him and get the slides done. So thank you, Dr. Sunil. And I'm very happy that Dr. Madhukar is here. So a big actually thanks to Indian Psychiatric Society at the national level, South Zone, and the state level for taking up sports in a big way and giving me that freedom to continue with that. And Spandana Healthcare too, Dr. Mahesh Gowda and Spandana, which have helped with respect to the coordinating the Spandana Cup for the staff of rehabilitations centers. How do I go about it? So I thought I will have a small, outline of my talk so that there is a bit of structure rather than just going only to the last few bits. So think about sports and the sportsmanship, the history, and what has been the moment in in our country, sporting lives, and what has been happening in the last few years. Then naturally towards BRCL and role of mental health professionals and the establishments, how it can help, how it can be incorporated as part of rehabilitation. Now, just to define sports, it includes all forms of physical activity. So it means whether you go for a walk, whether you do skipping, bicycle, whatever you do, it's naturally your choice. But that contributes to your fitness, it contributes to your mental well-being and interaction. So we all know sometimes it could be individual sports or team sport. Now, when we talk about sportsmanship, this is something I'm sure the counselors, the residents all would remember. We have oath taking on the day when we have the launch of the BRCL, or for that matter, even on the ground also. So that's something to say that we are going to be fair, we are going to follow the ethics, respect the laws of the game, and we respect our opponents too. Now that's very important. So we don't mock at them, we don't show any disrespect, no sledging, nothing as such. So that's something which is part of our sportsmanship. So moving on, trying and understanding, this is a basic definition of health. All of you would be familiar with. More importantly, what is mental health? So when we talk about mental health as such, now that is something, it's a state of well-being, mental well-being, so which helps us to deal with our stress, able to realize our potential, and we also are able to contribute to the community. So naturally, when we are either at work or on the ground or any other place, we should be at the best of our health, be able to make some decisions which helps in our relationships, which helps in our work, and so on and so forth. And we all know that mental health is a basic human right. So not just the physical health, but mental health. So it is very crucial, not for the person alone, but for the community and the development in general. History of sports in India. When we talk about India and Indian history, not just the mythology, not about the civilizations, but also there is a rich culture of sports in our country. So modern day generation probably would think only about the football and the cricket, but there was a lot even during Indus Valley civilization, there definitely is mentioned the way swimming, wrestling, archery, all that was happening. And then you can see that during the Vedic period also, there was addition of horse riding, elephant riding. Then moving on with the Puranic period also, you have rope fighting, Buddhism and Jainism. So where even during those periods also, there was addition of other sporting events. So which shows that sports was active, sports was being followed and actively encouraged even during our ancient civilization. This is a timeline which helps us to understand that in 1500, or perhaps it was, before that, 1200, the most popular sport in the world, the football, which was for the first time played in 1200. And then cricket came much, much later. Okay. And as you can see, the rules and regulations of the game, everything started much later. But this is over a period of time that sport came to be recognized in sustainable development goals. So there is, starting with BC, and then over a period of time, the team sports gradually developed. This is again an interesting bit of the slides which Dr. Sunil picked it up for me as the Chaturanga, which I found it very interesting. Even in Indus Valley, how they you have a pattern where people used to play. Then you have the archery, which both in our epics, Ramayana as well as in Mahabharata, where you talk about Swayamvara, as a sport, or a person who won went on to get married to the princess. Previously, the warfare itself was based on, seemed to be based on the extension of sports with like for like, with respect to respecting the rules and regulations, and also the royalty which participated saw it as a way of upskilling and also testing their physical stamina. There are a number of sports which originated in India. My apologies, it shows cricket also. Probably, if not England, maybe we would have developed or discovered cricket much earlier. So Kho-Kho, Kabaddi, which has had a recently again, which has become more prominent with all the professional leagues taking in, and then polo, the British royal family when they were here, and subsequently also, which continues to be popular. Now, the fourth one which I have it is Kambala. Now, this is something of the coastal Karnataka. Recently in Bangalore, you would have, I think, read, or the people living in North Bangalore, the palace grounds, we had for the first time outside Mangaluru, we had Kambala. So, and the popular movie Kantara also showed about Kambala, which is a very popular sport, and Jallikattu, which always remains in the news, probably for the wrong reasons. And then subsequently, you have the badminton, Mallakamba, hockey. All these show that India has been a country which has encouraged sports, which was probably, over a period of time, maybe it lost its prominence, but now again, the last 15, 20 years, regaining. So just to talk about what happens. So when you have sports, naturally, what does it do? So the physical side of it and the effects on the brain. So you have increased blood flow, which also means blood flow to the brain, which also improves your connectivity of the nerves and better functioning of nerves, and also the brain derived. I'm not getting into too much into the depth about these biochemical changes, what happens, but suffice to say that it activates and it improves the functioning of the brain. So this is again few of the neurotransmitters which I have listed, and most of you would be aware of it, that it has a positive effect on our mental health. So moving on, exercise in learning and memory. So aging process, we all know that there is a gradual shrinking of the brain and there is loss of nerve cells, both the brain, the gray and the white matter, which reduces, resulting in difficulty in thinking and memory. What it has been shown in research is aerobic exercises. Aerobic exercises, as in use of where you use maximum oxygen, where the running, cardio exercises, cycling, all that will improve your functioning of the brain as such. So that reduces the atrophic changes and probably the synaptic connection, so that your functioning of the brain continues with maximum capacity till as much as possible. So that way there is a positive effect on the learning and memory because of exercise. So again, just carrying forward from the previous slide, it shows that activation of the brain, the prefrontal, which is mainly with respect to thinking, with respect to your judgment, is also, it functions better when there is aerobic exercises. So which links with all the other aspects of the brain. You have your frontal, you have the temporal and the parietal, basically to say that the association works better and you are able to have a good active life. Now, quickly moving to the benefits of sports. So I've already listed a few, and some of it, the physical benefits is about reduction in your blood pressure, the BMI, insulin sensitivity, that gets better. The people who are on treatment for diabetes would remember that their doctors would advise them not just taking the insulin, but also improving their physical activity. So that makes their blood sugar control much better. So also increase in bone density, reduction in heart disease and heart rate. The psychological benefits, the further slides I have where there are further the benefits being highlighted, but suffice to say that academic performance gets better, there is an improvement in their confidence, satisfaction, and reduced feelings of anxiety and depression. So there are psychological benefits because of exercises, and there is also social benefits. So we all know that when we work as a team, we are able to connect better, we are able to learn from each other, it builds relationships, it also improves the motivation part. So this is putting it in a proper, as in a cycle, to say that there is reduction in cognitive impairment. I wouldn't go to the extent of saying dementia, but there is improvement in type 2 diabetes, also has an effect on depression, cardiovascular. So you all know that the sports has an effect both on the physical, which includes the bone and muscle, plus your the endocrinal disorders like diabetes. So this is just putting it in a flow diagram, the mental health impact of sports. Now, when we talk about sport as such, depending on the type of sport you're choosing whether it is individual or as a team sport. So you have physical activity on one side and the social connections and support. So on the physical activities slide, if you look at it, I hope you can all see that it's about improvement in the neurobiological mechanisms, psychosocial, as well as behavioral mechanisms. Now, interesting to know the behavioral mechanisms. So once you know that there is, say, for example, a BRCL, you have a practice which has been set up by our counselors. So the people who are participating, so they all get up on a particular time, they are able to show much more discipline in their practice and also their exercise. So there is clearly an activity which includes the physical and on the social connections. So we've touched a little on that belonging and companionship, making more or new friends, being able to share, being able to see how the others are performing. So overall, there is an improvement in their self-esteem and also their self-control. The last two is I've talked about outcomes. When naturally, when there is a positive outcome, you have them, their performance is better, there is satisfaction, overall confidence, which does a huge world of good to the individual. On the other hand, there may be people, because of their own expectations of performance or individuals around. We all know that, when Team India, say cricket, plays against Pakistan, for example, we read in the newspapers about some people somewhere having a heart attack or having been rushed to the hospital because of chest pain. So there is the other side of sports also, the stress. If they are unable to manage that, there can be negative effects of sports too. Now, this is about the scan which shows about the blood supply and the oxygen supply to the brain. So naturally, the one on the right-hand side, which shows the active brain, where a person has been walking or exercising, there is the blood flow as well as the oxygen absorption is much higher compared to the one who is sitting quietly. So there is every reason for all of us to have exercise as part of our routine. So moving on, sports for education. In fact, even yesterday also, I was seeing an advertisement on the TV. So more and more schools are talking about facilities available, facilities for sports. Maybe that is one thing which attracts the students. So any school sport programs where the attendance is better, their classroom behavior, it has been shown that they are much more disciplined. They have the restlessness is reduced. Maybe to some extent, children with ADHD also benefit where they have some physical activity. They are able to focus better, and overall their performance is better when there is sports as part of their curriculum. So we also have on the right-hand side concentration in memory, improvement in concentration, memory, reading, writing skills. So overall cognitive skills, which is said to get better when there is, the proper mix of not just curricular activity, but the sports too, as part of their education. Health, we talked already about the positive effects of health. Just to reiterate few things, there is a better sense of control, enhanced body image, belongingness. Now, psychologically, all these things, make a huge difference. And for somebody who is probably either feels neglected or feels uninterested in activities, bringing in all these sports activities improves that. The last one about maintaining stamina and resilience, I've touched upon it. Regular activity makes them much more healthier. Gender equality. Now, this is something we have seen that the IPL or any of the sports wherein there is greater participation, be it audience or for that matter as participation in sports too. It's encouraging more and more from the, the girls or the ladies to be taking part, which is a very healthy sign. However, I must say in MCC, I was told, I think as late, I think till late 1990 or so, the ladies were not allowed in the MCC, member stand. So it's only recently. So even over there in a developed country, the gender equality was not there, but now gradually it is getting better. So what it means is their self-esteem gets better. They are able to see how things work, and they also have better understanding of their physical condition and can take more care of the same. Sports for employability. Now, there are many sports persons who, based only on their sporting skills, also are given jobs. Banks are a very, the source of employment. Banks are very favorable towards sports persons. What it says that sports improves their efficiency at work. The sports persons are much more disciplined and they are able to work as a team. So that improves their efficiency. There is some of these things which I have highlighted in the previous slides: the problem solving, positive thinking, empathy, and resilience. So all these things can be positive indicators, and clearly when sports is part of an employment, it brings out the best in the individual. Now, sports in people or persons with disability. Now, we are talking about physical disability here. It improves this coordination, and we have Paralympics, and we have cricket for the blind and other disabilities too. And what we have seen is naturally there is improved coordination, there is normalization of the physical strength to a large extent, and it helps combat stigma. So they're getting their share in the media. They are able to, have that kind of confidence to say, talk about their disability. Otherwise, probably they'll be hiding, in some corner. So it breaks down the stereotypes of disability. They have their ability, and that ability can be suitably utilized, and which improves their confidence. So also talks about how still it is we all know that in spite of the sports for people with disability, but there are a lot of places even in our cities, be it the cinema halls or other places, where even ramps are missing. So we really have a long way to go, but somewhere the beginning has been made. Now, I had a point about the sporting nations. Now, this is an interesting slide where you have a list of countries based on how sports are actively encouraged. And sad to say that we don't see India there, in spite of having so many pro kabaddis, leagues of cricket, badminton, and kabaddis or whatever other sports, but nowhere near within the top 15 or so. So as expected, United States, France, China, and Great Britain, and they have that sporting culture, starting with youngsters itself, where you have, whether it is rugby or football, swimming, each individual is allowed to, choose a sport of their choice and then subsequently continue that. So this is a slide to talk about performances, be it in their major sporting events, including Olympics, Commonwealth Games, and all that, where their performance and winning goals and all that, you can always see that they perform much better. So we have a long way to go to find a position within the top 15 or 20. Now, this is a movement in the last probably 4 or 5 years, 2019, I think, 18 and 19, Khelo India. So every year in the last 4 years, we have universities having sports activities, both school, college levels and all that. And what would be a Government of India initiative? So taken, and it's being celebrated, or they encouraged all over India. So what does it mean? You're encouraging for field or encouraging development of sports. You have coaching, you have recognizing talents, young talents at a very young age, where they are handpicked, and with their suitable talents, with proper training, we hope to do much better in at both national and international level. Then also, not only at the national level, but also the states and the interstates also. Naturally, physical fitness is encouraged. We also have a particular category for women and people with disabilities. But I was looking for, within this category, we still don't have a category for people with mental illness. So that hasn't found its place. Maybe the Government of India needs to be reminded there is a big category which needs encouragement. So the salient features being Fit India. So you have this marathons every other week. You have it, whether be it Mumbai. I think last week it was in Mumbai. So we have some in, probably in March in Bangalore or so. But encourages for a fit culture. So you run, you enjoy that, and which doesn't take a lot of money. So, and there are of course benefits, where in the financial help also for the professionals. So there is, as already mentioned, sports for women and the special athletes. which promotes peace and development. Now, I take it that this is something as diverse states, and you have states like some troubled states also. Just taking sports to such states improves that people visit and bring in some peace and development. We shouldn't forget that even when India, Pakistan, and Sri Lanka, we had some problems. I think it was in 1996 or so. Our cricket team traveled to Sri Lanka to play, to show that solidarity that we are with the people of Sri Lanka. So sports has been used in many ways to further peace, further development between countries and between states too. Now I'm coming to the last bit. I don't know how interesting it is, but let me share my whatever experience. Now, being a cricket player is natural for everyone, for anyone born in India, for that matter, in the subcontinent. So my journey was no different, playing at the school levels, playing at the college or the university level. And once I went to England, of course, I played in the senior division league cricket too. But somewhere at a stage I reached that I thought I was getting a little bored. So I retired. That was a decision. I said, look, one day I'll retire as an active cricket player. But I still wanted to stay close to the game. And how else can I do that apart from becoming a cricket umpire? So I started training, and then of course the Association of Cricket Umpires and Scorers, which Dr. Ajit Bide referred to as the Lords. Yes, they are headquarters in the at Lords, and where I became the cricket umpire in 1998. And a matter of pride, where I was the first Asian cricket umpire in England, where I was interviewed on BBC radio, and also had my share of publicity in the local newspaper. And the photographer who had come to take my photograph said that in his life he had taken 2 photographs, or 2 umpires' photograph he had taken. And then I was looking at him surprised. He said, the first one was Dickie Bird, and then the next one is you. Anyway, that was a moment, where I was still working in Barnsley, where both Jeffrey Boycott as well as Mr. Dickie Bird, both are from Yorkshire and from Barnsley. And incidentally, my daughter was born in Barnsley too. So I had that slide to thank my family. Now I must say that, yes, Anita is here, Neha is here. It's during those days where I was working, the weekends were completely reserved for cricket. I used to travel, 40 kilometers, 50 kilometers, and just to do my umpiring. I would have started very early in the morning, would come back late at night. And even during her pregnancy also, I remember I had to go and do my umpiring. Now, it was required that I had to not only write my exams, but also do my on-field umpiring, which had to be assessed to. So yes, I was planning to, which I did. I returned to India in 2003 and to straight to St. Martha's Hospital. Cricket was active. Cricket was very much alive. I continued to be an umpire till 2005, but again, having to change my schedule was becoming tough. So I said, look, I'll retire from umpiring too. So then moved on to becoming organizing the cricket matches. So apart from the local at St. Martha's, the first one, the inter-hospital cricket. Now that's something which we did in YMCA. We had 15, I have written as 13, it actually was 15 hospitals, including MS Ramaya, NIMANS, all the people who participated. Many of our psychiatrists do remember that even to this day, where we had professional cricket umpires, simultaneously the cricket matches going on. Yes, now annually I get involved. I must say that this all happens because of a lot of help from others. A lot of responsibility is shared by them. So it is not just me. Yes, 3 for psychiatrists. Now this is something which takes me all over the country, not only Karnataka, all South Zone. Last, I think it was in October, we were in Guntur, and Kochi, of course, last week. And next time it will be in Hyderabad. So lots of things which keep happening, which keeps me active. And one for, naturally BRCL. I don't have to say much. I'll come back to that a little later. And then staff for rehabilitation centers. Now, when we were doing BRs here, there was a request from rehabilitation, staff, not only from MPA, from other centers, saying that we're doing all these things, but we are not having a cricket tournament staff. So that is how we started, and Dr. Mahesh Gowda has been most encouraging in continuing with that. And we are now into the 7th edition. Next week, we are having the Spandana Cup. Now, without doubt, IPL played a big role, and Dr. Ajit Bide would remember that I was not a big fan of IPL actually when it started in 2008. My brain works as far as test match goes on, but T20 was difficult. So there was a big cultural shock to me from moving from, say, test match to IPL. However, I had to make quick changes within myself because I see that I have to adapt. Otherwise, cricket, I would lose interest in that. SMPL. Now, I did say in my credits about St. Martha's Hospital. Now, here comes St. Martha's Hospital. I must say that the management of St. Martha's Hospital, Sister Teresita and Dr. Rajan, of course, Dr. Ajit Bide knows them. I had the discussion, at point, the thought came to my mind, why not have that a tournament which has ownership? The way you have a owner, that somebody own the team, you bring in players from other hospitals also as foreign players. Now, we are talking about 14 years ago. Okay, IPL starts in 2008. In 2009, we are having a SMPL with other doctors coming and playing in St. Martha's. Now, to me, that was something which was huge because all the other doctors also couldn't even think about it. But that was possible because of the encouragement from people, from Dr. Ajit Bide and the rest of the St. Martha's. I know Dr. Ajit had his own doubts. Should we be having this kind of a tournament? Would it not make it more like, encouraging, match fixing or whatever it is? But I said, no, we'll just go ahead and see. Until 2017, till I continued at Martha's, it was a regular event. Now comes BRCL 2010. Now, Dr. Sabani, Mrs. Lata Jacob, and all the office bearers, when we talked about it for the first time, a rehabilitation cricket league for psychiatric residents. Now you have 3 photos here, and it's something which I can only express once we discussed it in the meeting. The answer was yes, we will do it. So there were no two thoughts about it, and I'm sure over a period of time we have learned a lot. There has been participation from, I think initially we had 6 rehabilitation centers. Now we have 5. And I've heard from several, we have some feedback from the rehabilitation. But even the other rehabs, when they heard from MPA about organizing this cricket, they were very enthusiastic. Let's accept it. A cricket tournament happens because of cricketers. And those cricketers here are people, our own residents. And they wholeheartedly supported it. And that is how BRCL came into effect in 2010. And we had a break because of COVID. Otherwise, we have had the 12th edition in 2023. And I think going by the overall experience, so far it's been an extremely encouraging and extremely learning and an enjoyable experience for us. Just having a timeline, the SMPL, BRCL, now that led to the Psychiatrist League. Now, what we followed was later, we wanted to work closely with the Indian Psychiatric Society, Karnataka chapter. So we started inviting the presidents or the office bearers to come and watch our cricket. And that is how when Dr. Ravish and Dr. Mahesh Gowda were there, they came up with the idea, why not we have a cricket similar tournament for psychiatrists? So what we did in 2016, you wouldn't believe it, in the same year, we had 3 cricket tournaments. One in Chitradurga, Mangaluru, and Chikamagaluru, the same year. So which was getting a little too much. Then subsequently, we made it an annual event, and this has been received very well. And we had more than 80 psychiatrists all over Karnataka. And what it has done is bring the young and the the more seniors or experienced together. And we have a very senior psychiatrist called Dr. Vijay Kumar, who is at 80 years comes and plays cricket. Okay, so that is most encouraging. And we have the South Zone, which was inaugurated same day, and now the IPPL. So those two things which I already mentioned, which is going on a regular basis. And that's a photo which I must, again, I can't avoid whenever there is a cricket presentation. I dreamt of playing at Lord's. Probably I was about 6 or 7 years. And then I said, look, I never am I going to give up that dream, but at least, setting foot on Lord's, being at Lord's, it is a very cherished moment. Walking through that long room, most cricketers, people, for them also, it is such a something they look forward to. I could go through that and I could have that photograph at Lord's. So thank you for that opportunity to have that. And this is just in general feedback from the the participating residents from other centers. You can see that overall they have been very happy with the way the BRCL has been conducted. They felt it was fair. They were playing with professionals and with their own friends and people from other centers. Now I can tell you that when they come, they look forward to, they go and meet the other residents. It's such a wonderful thing. All for all, starting with residents, our own office bearers, having that, it's a festive atmosphere, festive spirit there, which brings all of us together. A one-day event, but a lot of planning goes into that. Now, there are other shortcomings too. BRCL, it looks rosy, everything, but there are other challenges about finding a ground. Lucky we have the Holy Ghost Church grounds, which they have been very kind for us to use that. There are challenges of finances, challenges of getting the players fit, and the physical side of it. Always there is a scare, because we take that responsibility of getting all the residents. Some of them may have physical problems, some of them have, whatever, whether heart problems, but we have incorporated having physical examination. Something else in the last 2 years, which again, an idea which came about is inclusion of female residents. So all the other centers have taken it very positively. So instead of just being as spectators and cheering their male, the residents, females come and take part. Now that is something which has been very well received. In fact, there are other centers who are saying, why not make it a 50-50? Maybe a day will come, we can have a separate tournament for lady residents too. Moving on, mental health of sports person is something which is there in the news, whether it is, I'll have some photographs, but naturally, anybody, if they can, when they are exposed to stress and strain, when they are in the limelight, when there is expectation, pressure of performance, huge financial considerations are there, they can go through anxiety, depression, which is very common. And of course, in contact sports, we know that, particularly in boxing, it's sad to know that, Muhammad Ali and the others who had to go through Parkinson's disease, we all know about it. So luckily, cricket, not so much, but yes, one cricketer from Australia, unfortunately, passed away after a concussive head injury. But overall, the psychiatric problems as such is no different. And yes, when it is recognized, when it is treated, naturally they can respond and can be back on the sporting arena. We have, all of you will remember how Maxwell played in the recently held World Cup. Yes, you have all the other icons who are here, who have gone through and who were bold enough to admit about the psychological health issues which they went through. But naturally, when somebody who is a sporting icon talks about it, it helps even the others also to come forward to face and get treated. Now, I was talking about the publications. Must say that there are publications from the other countries. This is one of our first publications. I'm trying to, talk to Nimans about our BRCL2. This is something which came in collaboration from a lot of, psychiatrists from Nimans and Dr. Ravish in Mysore and myself, where we talked about how, sports psychiatry is still in its infancy, but naturally there is a lot of ground to cover. But at least we made a beginning to try and say that yes, sports psychiatry is something which we can develop on, and there is scope for it, scope for help for the people who are into sports, and also to look at the general mental health of encouraging sports. So coming to the last one or two slides, this is from my CADABAMS center, where this is a very newly built sporting arena. We have the gym, we have the other facilities you can see on the right hand side, and I can tell you there is encouragement for all sports, be it cricket, football, and everything. So the last few points, sports and physical activity, just as a take-home message, has its positive impact on all aspects of health, be it physical, mental health, socializing, and of course, even in psychiatric rehabilitation. If you can integrate sports, it makes a job a lot easier for the professionals involved, as well as the families also, because they become much more active. So I'll leave this presentation with the two famous, probably the sporting icons, one Kapil Dev of our generation, the MS Dhoni of the recent one. Sports should not become routine. It should be about passion, which I believe in. And of course, we all have to learn to respect each other. Each one has his views, and Dhoni and his talks have become extremely popular even in management schools too. So thank you very much for the opportunity, for allowing me to talk about sports and mental health. And I know it was more like a helicopter view, but I tried to do my best within that time. Thank you, and here to take any questions and clarifications. Thank you very much.
Madhu, you can stop sharing now. Stop sharing.
Yes, sir. Thank you.
Thanks very much for a very entertaining and educative presentation, Dr. Madhukar. Just 1 minute. Dr. Abhay Madhukar compliments you on your exhaustive talk.
Was exhaustive. Sorry about it. I think I took much more time than what was allotted to me.
No. I don't think that was it at all. I think this was, every minute was worth it. Lorna has also complimented you and said this is a truly useful talk. Ganesh says, excellent perspective. Our time was well spent. Are there any questions or remarks that people would like to share? You're most welcome to put them in your chat box, and I'll request Madhu to field them as a good cricketer that he is. Madhukar mentioned that when we introduced this first Premier League at the hospital, I was very nervous because Madhu and I had been talking about how betting is going to take the better of everything, and IPL is going to be lose its sheen because other factors, mainly monetary, of course, would come in. And I was stunned to learn that Madhu is introducing it in Martha's itself. I said, "Oh, please don't do that." But I was proven wrong, and I'm very grateful to have been proven wrong because it was great fun all along. The various cricket leagues that he has introduced, not just introduced, but seen that they survived. Almost every one of his ventures in this cricketing leagues has thrived over the years. Of course, COVID was a bad spell for everybody, but we've recovered from that. Madhu, I have one question for you. Madhu, if you can
Please
unmute yourself.
Please.
The Indian sports, Kabaddi and Kho-Kho that you mentioned, call for very little equipment. And only lately have they got the kind of prominence that they really deserve from a very long time. What's your opinion about introducing these, quite apart from the other Western, so to say, Western sports that games that need equipment?
No, certainly they deserve their importance, no doubt about it. I think probably it will take time for it to be accepted. Now, if you look at it in cities, since both of us live in Bangalore, or all of us live in Bangalore, except for a few people who have joined from outside. Now, some sports like cricket takes over. Now, the very fact that you have so much of coverage, be it on TV or in other channels, maybe overshadows the other sports. But recently, at least Kabaddi, where you have the celebrities getting involved and it's being shown on TV, and to some extent, it is, I think it is, we are in the right direction. If not in the next year or two, I think in the next 4 or 5 years, even all the traditional sports will get its due. And more, when you have support from, be it the Bollywood celebrities, whether we like it or not, they are the ones who have the, the cash getting into that, or the rich industrialists, be it the Ambanis or the Adanis. But once they get involved, once they are putting in more money into that, it becomes a livelihood. So we shouldn't forget that cricket, we have, all of us would have seen, whether it is 14 or 15-year-olds boys coming to us saying that we will stop studying, but we'll take up cricket. When we ask, they start talking about Sachin Tendulkar becoming a millionaire at the age of 16 or 18. Now, that kind of money hasn't come into these traditional sports yet. So maybe somewhere, I'm not suggesting that money should be more, but it's the fact that encouragement, it's the fact about more coaching professionals being there. And we shouldn't forget that Khelo India is just about 4 or 5 years old now. So that is more like a mass movement. And I have seen that on Kanakpura Road, when we had recently, about 6 months ago or so, in Jain Institute, Jain University, loads of bus, and which caused, a lot of people to inquire what is going on. So there is hope. There is definitely confidence that even the traditional sports will get its importance. But I must say that having been an unbiased or a biased cricket fan, nothing can beat cricket in this country. So we can't do anything about it, but it's just we have to accept it and allow the other sports to survive.
I like your quick confessional about your partiality to cricket. Dr. Abhay Madhukar has raised his hand. I request Dr. Abhay to...
At the outset, his passion is exceptional to sports, to what it talks and what it does to sports. And now, obviously, he is committed to cricket. Thanks, Madhukar, for an exceptional talk and quite motivating. Coming to the other perspective, basically, we all as Indians talk a lot about sports, obviously including cricket. But when the end point comes, let us say when we are chasing a dream or taking a trophy or, winning a trophy, what is that which lacks in us? Let us say there are certain other countries, I'll give you today's example. I'm sure you are not following, but I can tell you what's happening today. England was 5 down, but Olio Pope scored a century. And he's chasing a dream that in spite of his team being 5 down, 6 down, he scored a century and he's keeping his country's hopes alive. That is somewhere which I feel India is lacking. Do you find any commonality as to why this is so in our country?
No, I see, just to answer the question, with respect to we as Indians, instead of focusing on winning one trophy, focusing on the end result, if what I'm not a, I must confess, I'm not a huge fan of MS Dhoni, but I like what he says on focusing on the process. Now, where are we? See, these whatever the modern legends, whoever is there right now, for any sport to develop that kind of discipline, to understand the failures also is very important. So having an approach where you naturally you will fight till the end, and it's not as if you're starting on the back foot. See, I'm sure all of you, remember, at least from my days, I can remember 1971 when Sunil Gavaskar started. I'm sorry, again, I'm focusing only on cricket, but naturally, the rest of the sports, I find it difficult to talk about it. But there was a time when, if Sunil Gavaskar was batting, for that matter, even my mother would say, Gavaskar is there, why are you worried? Okay, now she would follow the cricket to some extent because she had to talk to the children about what is happening. No, but she had the confidence in that one person to say that, look, he can save you or he can take the team through. Now, whatever the present achievements and what we are seeing did not happen overnight. So a process was started and which we are carrying. So there will be failures. There will be lessons to learn from whatever what happens. So, but sports is such a thing that we have to understand. On a particular day, your opponent may be better than you. Why should you give up? Why should you feel that you are inferior? You do your best. You can do whatever your skill sets are, and then you have to respect, have to understand that your opponent can be better than you, and you go back to your dressing room, or improve your skills, improve your confidence. It's not that just you lose. What happened, even whether in semi-finals when India lost to, I think it was, or in the finals, India lost to Australia. It's not about just that particular match, but how did they approach, what they did. So I think there is a lot to learn from the champions. There is a lot to learn rather than becoming emotional. See, we are a highly emotional country. We lose one and we say that our sports persons are the worst in the world. Can they become worst in one day? Not at all. We ourselves have put them on the pedestal. We ourselves have said that they are the best. And when they don't perform, then do we say that they are the worst? I don't think. See, the understanding is, we as psychiatrists or mental health professionals, if we look at it, anybody can have a bad day. We ourselves can have a bad day too. Aren't we all human? So our sports persons are as human as us. But the importance is about building their resilience, building their confidence. And if there is another day, you have another day to go back and correct it whatever you can. So I think just going back on our, the sports makeup, sorry, Dr. Ajit Bide, if I'm taking a minute or so answering this, maybe there are other questions. But as parents, how encouraging are we for our children? If somebody says, I want to take cricket, and I can talk from my own experience, my father was very clear, look, can you make a livelihood of it? Can sports be your livelihood? The answer was no. Okay, so then it can be, you need to have a backup. There are people who have had that, whether it is Anil Kumble or Rahul Dravid or whoever it is. Tendulkar happens 1 in a billion or whatever the centuries, not every day. So our parents, as parents, we have a responsibility to try and encourage them sports, but at the same time, we need to have some clarity. If you have to have a plan B, you have to have that academics, you have to have a career. So sports as a career still is a long way to go in our culture. So we have to open up, and probably Khelo India will help. And okay. But apart from that, I think we as a developing country, we are still developing even in sports too, not just in technology and other things.
Right. There's a question from our administrator. Lorna, I'll come to you in a bit. Bhaskar asks very relevantly, should mental health institutions have mandatory play areas as a requirement? Should the authorities include them in the criteria for infrastructure? I think that's a very fascinating idea. I wonder what your take on that is, Madhu.
Well, if this space, the availability of space is a big, big challenge to all the centers. Yes, at CADABAMS, we are fortunate. We have huge area. and we are able to develop on that. But at the same time, if there is a, naturally the will and the determination and the motivation in the planners or the, administrators, within the available space, if you can make one, I am a firm believer, as my title suggested.
No. Bhaskar is asking, well, should we make it mandatory? That mental health institutions, not only rehab centers, mental health institutions, let's say demands.
Mandatory is a big word because not many people may like it. So I think, again, like being from developing to develop, it's a big transition from right now being a recreational sport to making it mandatory. That calls for, but if you have me as the administrator, I certainly will vote for it. Okay, right. I'll make it mandatory for everyone to play cricket, but not just cricket alone, all the sports. But how many will think like me? I don't know. And how many would be lucky?
Let's hope more and more think like you.
No, not only that, how many will be lucky to have supporters like yourself and all the others? Okay.
Bhaskar likes your answer. Okay, Alona, if you could unmute yourself. I see you raised your hand for a while.
Yeah, sure. I want to ask, I was really particularly interested what you were saying, sir, about education and the benefits to education and well-being in relation to sport. I'm actually in Scotland, so I'm very aware that in our country at the moment, there is a lot of recognition of the benefits of physical activity for education, mental health, and a whole range of things, at the same time as all the school budgets are being cut and everything to do with physical activity is being cut because there isn't money for it. So there's a huge tension between what people know to be beneficial and what people are being offered. I wonder what the situation is in India and how far educators are aware of the benefits of physical activity for learning.
Thank you for that question. I was just reminded, Scotland being so near to England, still cricket is not so popular. Although in spite of Rahul Dravid coming and playing in Scotland.
It's basically too cold to stand about. That's the problem. If you're fielding, it's okay when you're on the batting side, but fielding gets a bit cold.
It does. But answering your question, see, the cutting, the funds being diverted. Now that's again very much a political issue. Sorry about the noise. Some work is going just outside my room. So just to answer that, it's a political decision. So what are the compulsions locally diverting funds from your country? You would know the best. But coming back to the question from the Indian perspective, say I can talk the government setup, still the getting the basic facilities, even having a playground is a challenge. Okay, people in children studying in government schools, having a small area to play the Indian sport of Kho-Kho, of course, cricket, it's all happens on the same ground. So which doesn't need too much of funding for that. However, if you move towards the private education, now private education, in fact, that is one reason they talk about sports, they talk about the multi sports and the facilities, and the parents feel the pinch because the rates, the tuition rates and the sports fee, everything is very exorbitant too. So which can be very difficult for a parent. If you have one child itself is difficult. If you have two or more, even more difficult. However, because you are balancing, good education comes with all the other, the additions of sports fee, whatever other equipment fee and all that, it's still going to, burn your, the parents' pocket quite big. So I would say that the challenges are very similar here too. In the government setup, since I don't work, but I am aware of the government facilities, how things are, it's not great. So it's not great, but it can be a lot better than what it is. But in the private level, since they pay for the facilities, there is huge, that infrastructure is already there. So in India, you have the health sector, which is private, and the government. If you talk to the government facilities, the staff who are working in the government sector, they will say there is perennial shortage of resources. But at the private, if you work, naturally the expenses, the costs, everything goes up. So it's a question about balance, which one you choose. So the same kind of challenges what you have in Scotland, we also face. But since people pay for that, they know what is. And the private facilities continue to, that's a good attraction for them to, it's a good attraction point for them to get more students, not only about their grades, but also about personality development, involving sports, yoga, meditation, and all that for overall development in the child. So that's how things are. I hope that I've answered your question.
Thank you so much.
If I could just add to that, at the graduate and postgraduate level, Pranay Roy, who was one of the leading broadcasters in our country, had his TV channel, what used to be his TV channel, NDTV, had introduced sports for education, and were modeling themselves on the US universities, which gave a lot of incentive to, because competitive sports is a lot of prestige over there. So you have the best basketball team, you have the best baseball team, and they are encouraged, they're given scholarships at the postgraduate level. NDTV tried hard to implement that in India, but beyond making some noise about it, nothing, we didn't achieve much. That's the sad fact that we university. Rohini, I would have asked you to ask the question yourself, but on your behalf, I'll read out your question. She says, thank you, Dr. Madhukar. Indeed, all of us thank you. Individual sports versus team sports, which is better for mental health, do you think?
I don't want to, people to think that one is better than the other. It's something what you are comfortable with. You choose, it's like music. Which one do you want? Similar sports also. You are good at it. You want to try individual sports, go for it. And it doesn't prevent you. If you are good in individual sports, you can always try your hand even in team sports too. But as far as mental health is concerned, it's about enjoyment. It's about respecting the rules and regulations of it and being consistent with that. Playing one day an individual sport, playing tennis, and you end up naturally with aches and pains. And the same happens even in cricket too. And of course, there are some personalities, that is how I look at it, where, if it is a team game, you may be the captain or maybe a player. So you have to understand the strengths and weaknesses of your other players, and also understand that the person is maybe having a good or an off day and should be willing to fill in that. Now, if you're having that kind of understanding, it's better for a team sport. And naturally, whenever we talk about sport, any sport for that matter, improves your mental health. But choosing between the two, I would say that it's a personal preference, and whichever you do certainly will improve your mental health. And you don't have to force yourself into team sport if you don't fit in. Choose individual sports. If it is tennis, if it is badminton, enjoy that. Or if it is, roller skates, why not? You just go there. There are others, but you are playing. And like squash or other sports, I don't know what else it is there. But tennis, all that, it's about improving your physical abilities. Golf, for that matter, also. You set your standards and improve on that. So ideally, enjoying, making it pleasurable, consistent, and if that is the case, both in individual as well as team sports.
Thank you.
So I got one question, Dr. Ajit.
Yeah, Sam, go ahead.
We have this occupational therapy in our institutes, So to what extent we can introduce this sports therapy, and to what extent we can expose the person's mental illness, so that it will be benefited, because I am very thrilled to see so much of benefits as described by Dr. Madhukar. So is it okay that if all persons can be inducted into sports, and then will they be able to take it? Number one. Number two, whether to what extent we can introduce this occupational therapy, sports as occupational therapy.
Right. Sports, I'll answer the second one and come back to the first. Sports as occupational therapy. Now, naturally, when we talk about occupational therapy, it is about improving the skills, what they have, or learning new skills with a view, whether in terms of, continuing with that, maybe getting some gainful employment too later on. Now, if it is a sports person, if he has lost his skills and if he wants to come back to more like a rehabilitation, the occupational therapy with respect to sports can be useful. However, having only sports as occupational therapy may not be a good idea, because you need to include other aspects of occupational therapy too. Now, the first part of it, whether introducing, now it depends on, we can't force it. We can't. So naturally, there is a liking, there is an acceptance, there is a willingness to try it. Now, there may be some physical attributes also, or physical limitations also. One has to look at it. So what are the sports? What you can say in MPA, and what are the residents which they like, and what are the facilities you have? Certainly, it's something which we can, initiate a discussion and take it further, which suits the residents and maybe gradually improve. But the occupational therapy should not just be sports, and I am a firm believer that there are other aspects to that also, and I'm sure an occupational therapist would be the right person to guide on that particular area.
Right.
Thank you, Madhukar.
Thanks, Madhu. This will be the final question. This is from our senior counselor, Anish. He says, hi, Madhukar sir, how do you see the DRS system in cricket, which is something new? If DRS was available during Sachin's time, he would have no scarcity for centuries. Does DRS have any connection to our practical life too, both personal and professional? And I'm going to add mental health too. Sachin's mental health
what is DRS, please?
It's a review system for decisions taken on the field. If you don't like the umpire's decision, you're given each team is given 5 chances or 3 chances to for a review system where the third umpire sits and reviews the situation. And I don't think Sachin's mental health suffered because he didn't get all the centuries he might have deserved, going by what Anish is implying in his question. But I'd like the expert umpire to, our third umpire to come in on that.
Now, even during my umpiring days too, we used to have a lot of discussion. Can technology replace the umpires? Can technology replace the humans? The simple, straightforward answer is no. So we have the DRS system, we have the, what is the other, Duckworth-Lewis methods, and lots of additions to making it interesting. However, we have to understand the DRS system is all available at a particular levels of cricket, but not at the lower levels. So we still have
not in BRCL.
So far, no, but maybe there might be a demand sometime later. We don't know. But the fact is that these are all improvements which we need to, take it in our stride. As an umpire, I would say that if something is going to make my judgment better, make me, even if I go wrong, so what? If the technology is going to say that, my decision has to be overturned, I'm open to it. So likewise, there have been many instances where even DRS decisions have been questioned too. So DRS is not something which is foolproof 100%. So there are human errors. So likewise, DRS errors too. Next, why the point about Sachin and all that, I would just leave it at that. Sachin was happy. We all scored and, whatever. I'm not a huge fan of these statistics. Much more, the fluency or whatever the elegance of all that, which I enjoy. As far as our personal, professional life and all that, I don't think there is such a question right now. We don't have that UDRS. Let's accept it that we all are human beings. We shall remain as human beings. We have our strengths. We have our frailties. We'll adapt, adjust, and live with it.
Thank you. Though I said that was the last question, I want to use the chairman's prerogative and ask you one. The recent controversies that arose with our wrestling teams, do you have anything to say about that? Because that really demoralized a lot of our sports people. For those who are not familiar with it, our female wrestlers had a protest about the chief of a wrestling federation, which were just overlooked or pushed aside by the government, and that caused bad blood, and it's still not a controversy that has died out. It's very demoralizing. Madhu, your take on that?
Yes. Thank you very much, sir, for asking that. And I must say that I'm extremely pained with that. You have the athletes and you have the administrators. Now the administrators get the support from the people who matter, and the sports persons or the wrestlers hardly any support. Even for that matter, even the women who are in power did not support them. Now, I am no investigating agency, nor do I know the full facts about who is right or wrong. But the fact is, it should have had the person who was heading the agency or heading the federation should have been asked to come out of it, or should have been suspended. Action should have been taken much earlier. Now, justice should have been done to the people. I fail to understand. It is not one voice. There are several people of who have brought immense glory to our country, who have brought so much of pride, and now they find themselves being questioned, their decision being questioned, which is very unfair. So I am for a thorough, the investigations, and the people who are in power, people who are sitting on that or who are preventing that to happen. I feel sorry, and that's where I feel that even the highest court in the country should have intervened and should have. So I am for the athletes till something comes against them. So I'm very clear on that. I support the athletes.
Before I let go, Dr. Mohan Isaac is here. May I request Dr. Mohan Isaac to say something, because you were acknowledged as Madhu's teacher, sir.
Thank you, Ajit. I'm sorry, I'm sitting in a slightly darker place. Not in Perth, not in my office or home. We have come out to some other place. But I was so keen on listening to Madhukar. I saw him a few days ago during the ANSIPS. I just want to say how thankful we are, MPA, is to you, Madhukar. Your passion is infectious. You have created this BRCL, which is, to my best knowledge, the only kind of cricket league match anywhere in the world for a group of, we say neglected people with chronic severe mental disorders. And every year, although I have not been there always, I know how enthusiastic our residents at the Medico-Pastoral Association, not only the residents, but also the staff, get so enthused when the BRCL time comes, and it is a time of celebration. And I understand that it is the same with all the other teams which participate in this. And you are singularly responsible, and we at MPA are immensely grateful to you for that. Of course, I know now these days that, lot of people attend the psychiatric conferences, not for the conference itself, but for the IPL. Many times I come on the second day and then I meet a lot of people. They say, oh, we come for the cricket match. Yesterday was a cricket match. That is again good. It is sports is bringing a lot of people to science, which itself is very good. Thank you very much for your wonderful talk. We have been waiting to listen to you. Now, I think you know that your tape, the talk will be recorded. It has been recorded. It will be edited, and it will be on the Medico-Pastoral Association YouTube. I missed a little initial part, which I will certainly, once the staff put it up, I'll be watching that. And of course, I would tell a lot of people interested in sports and cricket and all that. Also here in Australia also is not as mad as India, but a cricket-loving country. Here, of course, it is the Australian footy which takes the place of cricket in India. But recently, the India-Australia finals had created a lot of enthusiasm, which Australia won, as all of us know. So I'll be telling some of my colleagues who are interested in cricket and who are working with us. I'm talking about not necessarily only psychiatrists, nurses, social, occupational therapists, etc., to listen to your talk, because it talks about not only BRCL, not only about the Indian League, but number of other things, sportsmen, mental health, and various other things. So thank you very much, and thank you, Ajit, for asking me to say a few words. I'm delighted to listen to Madhukar. Thank you very much. Back to you,
Thank
Ajit.
Yeah.
Sorry.
You have
can I say
compliments.
something?
You have compliments from Ramola as well as from Google Pixel 6, Miss or Mrs. Miss or Mr. I don't know, do not know. But I'm sorry, we are running short of time now. And
So
I
can I
see.
say, can I end?
Yeah, sure. Sure, of course.
Thank you very much, sir, for joining from Australia. But I must say that it is a teamwork. And the team at MPA have been most wonderful. All of them take on their responsibilities. In fact, my job is nothing. I just go around the ground walking, whether it is our psychiatrist league or whether it is BRCL or anything. So it is teamwork. And thank you very much for the opportunity given. Thank you, sir.
Abhay has a remark. I don't know why it is directed to me. He says, sorry, Ajit, there can only be one Madhukar. Whatever it means.
No, let me clarify, because otherwise it will remain a question. You said many such people should come to this field. I'm sorry, there can never be another Madhukar.
Such, not entirely identical. Okay, sure. Thanks. I can see that Denil's Saturday is being eaten away. And Denil, back to you for the remaining part of this evening.
Thank you, Dr. Madhukar, for an enlightening and informative lecture on Let's Pray, says the Umpire. Thank you very much. I thank Dr. Ajit V. Bede for having chaired this session. Thank you, Doctor. It was a very nice interactive session. May I request the audience to reach out to us on our email ID if you have any further questions or comments. The email ID is shared in the chat box. Thank you. Yes. We have now come to the end of the session. May I request Mr. Alphonse Kurian, Honorable Secretary of MBA, to deliver the word of thanks. Over to you, sir.
Good evening, everybody. Yes, let's play, and we would love to continue playing this. And I think, if I'm not mistaken, today we have the pre-launch of the Spandana Cup, Dr. Madhukar. Yeah, so that is our residence program where the staff of all these rehab centers have to be playing cricket. And that is to be on Sunday, 4th February, thanks to Dr. Madhukar, who is, always inspiring on cricket. Well, of course, I'm not a big sportsman, but then having come to MPA and witnessed 2 of the BRCL events, I would honestly say, as you said, it's really infectious. The staff are also thrilled. It's a teamwork, it's interpersonal skills, and all sorts of things. And yes, so we are really fortunate that we had such a wonderful speaker in Dr. Madhukar, who is more or less our MPA man itself, not like CADABAMS. So we would like to thank you very much for accepting our invitation and speaking to us, tracing the history, the benefits, and the impact of sports. Thank you, Dr. Madhukar. I'm sure we will be continuing our association with the BRCL as well, and all sorts of things. Thanks for the Zoom link, which made this thing possible for all of us to be here and attend to this program. Thanks to Mrs. Rohini, who had steered and got to it that we have Dr. Madhukar and all these things here. Our Denil, who is the captain for our Spandana Cup from our side. Thank you, Denil, for being the master of ceremonies, and wishing you our team all the best. Of course, we'll be fighting in the sportsman spirit. And Sri Bhaskar for the welcome, and all the residents of MPA who had rendered the prayer, which we generally get our residents to do. And Dr. Ajit Bede, who is always with us, who chaired the session, introduced the speaker. Thank you very much. Thanks to all the participants. Quite a few of our past office bearers are also here, and new members also I could see had some of them joined, as also others who are here. We thank all of you for having been with us for this talk. And once again, thanks to one and all. Have a wonderful evening.
Just one additional bit of information. We are having the second Joyce Shiromani Memorial Oration on the 10th of this February at the same time, 4 o'clock. We earnestly request you to spread the word. The flyer is available, and Rohini will see to it that it reaches you. Please join us for this oration, which is going to be delivered by a world leader in mental health, that is Dr. Vikram Patel. Thanks to the good offices of Dr. Mohan Isaac, we've got Vikram to give the oration, and it will be chaired by Dr. Tara from SCARF, Chennai. So do join us 2 weeks from now for the oration. With that, back to you, Daniel.
Thank you, sir. Thank you all for joining us in this evening for the wonderful program. Thank you, everybody. Please visit and follow us on YouTube page, where the recording will be soon be posted. Thank you.
Have a good weekend, everybody. Bye.
Yeah. Bye, everybody.